everyone, I am Christina Cassandra Cesar, and in this video, I am going to perform an open gloving return demonstration. As we all know, gloves create a barrier between germs in our hands. Therefore, wearing gloves protect both patients and healthcare workers from infection, and it reduces the risk of contamination from health workers' hands with blood and other body fluids. So before doing the open gloving, I have performed thorough hand washing. Remember that the use of sterile gloves does not replace hand washing, and so we must perform hand hygiene before and after every procedure. So I have my sterile gloves here, and ensure that the packaging has no stains and tears, and that the glove is on the right size, so that objects are easy to pick up, and this will ensure user comfort. So now I'm going to carefully peel it off and remove the outer wrapper of the glove package. So be careful not to spill the inside contents of the glove to maintain its sterility. Now, grasp the inner package and place it on a clean, dry, flat surface. Okay, so we have to place it on a clean, dry, flat surface because moisture can contaminate the glove. And the area must be at the waist level because any object held below the waist is considered contaminated. So now we're going to open the package and carefully pull these flaps. As you can see it here, this flap supports us in opening the package so that we can maintain the sterility of this glove. So carefully open it, and once opened, identify the left and right glove for easier application. So since I am right-handed, I am going to glove my dominant hand first, which is my right hand. So in order to do that, using my thumb and the first two fingers of my non-dominant hand, I will take the cuff of the glove and make sure to touch only the inside surface of the glove. And now I am going to insert my hand carefully. Insert your hands carefully and pull the glove over your right hand. So since I have gloved my dominant hand, I will also glove my non-dominant hand. And in order to do that, I will insert my four fingers of my dominant hand into the cuff of the second glove, which is the left glove. So doing this prevents the accidental touching of non-sterile objects. So now I'm going to insert my hand and carefully pull the glove off over your non-dominant hand. And make sure to keep this thumb of my right hand, this one, to keep it abducted back to avoid accidental touching and or being exposed to anything that is not sterile. Okay, so since I've gloved both of my hands, I will interlock my fingers to ensure it is well fitted. So place it and hold it away from my body at above the waist level. So this is to maintain sterility, and again, always remember that any object held below the waist is considered contaminated and not sterile. So okay, this time in removing our gloves, I will pinch the outside of one cuff and hold it halfway down, and just let the thumb be exposed, just like this. Now, using the thumb of the half ungloved hand, insert your thumb under the cuff of the second glove. So doing this prevents the contamination of the hand when removing your gloves, because our thumb, this one, is considered clean, as well as the inside of this cuff. Then carefully pull it inside out and discard. Now take the fingers of your bare hands and insert or slide it inside the remaining cuff and carefully pull it off inside out and discard. Now, doing that prevents the accidental touching of ungloved hand and the gloved hand. Now, discard this in the proper receptacle. Okay, so this time in removing our gloves, we have to pinch the outside of one cuff and avoid touching the wrist. So this is to prevent the contamination of the hand when removing the glove. Now carefully pull the glove off inside out and place it in the gloved hand. Okay, so now using your fingers of your bare hands, slide it under the cuff of the remaining glove. And carefully pull it inside out and discard it in the wrapper. So doing that prevents the accidental touching of your gloved hand and the ungloved hand. Now discard this on the proper receptacle. Lastly, perform hand hygiene using this alcohol to remove the powder from the gloves, as well as prevents the contamination from potential pinholes on the gloves. So that's it. That's how you do the donning and removing of sterile gloves. Thank you.